Late Night Health continues. I'm Mark Alyn. Our guest this segment of our program is Steve Mandel. He's a certified, board-certified anesthesiologist. He has a master's degree in psychology, and he has a clinic called Ketamine Clinics of Los Angeles. It's the country's leading provider of IV ketamine infusion therapies. And we've been talking about depression and suicidal tendencies. I mentioned as we went into our break that I thought that depression, when somebody is super successful, as you know, in the industry, in Silicon Valley, in finance, whatever it may be, they've got all the money in the world, they've got a beautiful house, they've got money left over after paying all their bills, and yet they're depressed. Could this be chemical?
Is that a question?
Yes, it is.
It is. One way to look at it is chemical. I think that's a narrow way.
Broaden it out for us.
But it's definitely in the mind, and to the extent that the mind is the same as the brain, and of course the mind is much more comprehensive than the brain, but it's definitely related to a problem in the brain. And one of the things that ketamine does is, when given the way we give it, actually cause new growth in brains. We don't know that for a fact in people, but we know that in other mammals. We actually cause the elaboration of growth factors in the brain and the laying down of new connections and new receptors.
Could ketamine then be used for things such as dementia and Alzheimer's?
It has been tried. It has not been especially effective the way we know how to use it now for dementia, or neuro injury. We've used brain for people with chronic brain injuries, and it does improve their mood, but it doesn't cause the new growth that we would like to see in the areas of the brain that have been damaged.
And I would assume the only way to do that would be through an autopsy.
Yes.
Yeah, well, I was going to volunteer, but I want to hang around a little bit longer. Tell us about the history of ketamine, because it was not used for this originally, was it?
Ketamine was synthesized in 1962, and it was discovered to have tremendous anesthetic properties and was approved by the FDA in 1970. It, unlike most anesthetics, supports vital functions like heart rate, respiration, blood pressure, and also, unlike other anesthetics, it's analgesic, meaning pain-killing, in less than anesthetic doses. So ketamine, which can be given intravenously, most anesthetics have to be given as a gas, really became immediately the darling of the battlefield crowd, because ketamine could be given in the field, if given in less than anesthetic doses, enabled people who were too much in pain to help with their own evacuation to actually stagger across clearings on their own legs with help and get into choppers. And there are thousands alive today because they got an IM dose of ketamine in the field in Vietnam and were able to participate in their own evacuation.
You deliver it as an IV, so could it be delivered as a shot in the field?
It is delivered as a shot in the field as an anesthetic, Mark.
Got it.
It works quite well as that. It was used as an anesthetic for many years without anyone appreciating that it had mood-elevating properties because it was given as a lump that way.
Got it.
As a one-shot deal. It was only in the late 90s, again, in treating people with war wounds, that people discovered that these were military people who were having surgery for war wounds, but who also were afflicted with PTSD. And some smart guy noticed that it not only was effective, the ketamine not only worked as an anesthetic, but the ketamine was relieving some of these people of their startle, of their nightmares, of their fearfulness, that it actually was lifting their moods. And of course, people didn't believe it. I mean,
right.
It's an anesthetic. It's not a mood elevator. So they did some demonstration studies, and it turned out that these very hardcore people who had not succeeded in benefiting from any other antidepressant were benefited by ketamine.
And at the same time, the people who were having surgeries would wake up in better moods, and was noticed. To have a ketamine series of treatment, they can't just walk in and get it. They need to be diagnosed with depression of some kind or another order.
That's correct. That's correct.
And so you work with other healthcare providers, psychiatrists, psychologists.
Well, yes, but many of our patients are self-referred, but they don't walk in. They provide us with documentation of a diagnosis of depression or bipolar disease or PTSD.
Got it.
We don't make those diagnoses. We accept them from other physicians, principally psychiatrists, but also internists and family doctors.
Gotcha. We are out of time. We'll have to do this again. Steve Mandel, the founder of Ketamine Clinics of Los Angeles. If you go to latenighthealth.com, we will have an article on the group, and we will post pictures as well, because I told Sam, the doctor's son, he had to have that up. All right, we'll be back in just a couple moments. Visit us at latenighthealth.com.